The Health Minister, Brad Hazzard, the Tourism Minister, Stuart Ayres, the Chief Health Officer, Dr. Chant, and the Commissioner of New South Wales Ambulance, Dominic Morgan. I'll be speaking in relation to giving a bit of a National Cabinet update from a New South Wales perspective from yesterday and obviously from COVID. Minister Hazzard will provide some further health messages alongside the Chief Health Officer. Dominic Morgan will speak to some of the challenges we're seeing with ambulance at the moment and some of the calls that we're receiving and the pressure on the system. And then Minister Ayres will speak to the tourism side of things and the importance of New Year's Eve here for our city and state. So today, once again here in New South Wales, we've seen a significant increase in case numbers, but what is pleasing is that our health system remains strong. And I want to particularly thank our health workers, our doctors, our frontline professionals who are out every single day providing care and support for people right across New South Wales. The key to us being able to open up society as safely as possible has been the great work and the dedication of our health staff and importantly the efforts that people have made right across New South Wales over the course of 2021 in getting out and being vaccinated. Today we sit here in a very strong position and we're in that position much stronger than last year because of our vaccination rates. When Minister Hazzard and myself and Dr. Chant were in some of those discussions months ago, we would never believe we would have got to a position of a 95% vaccination rate, but that is what we are on track to achieve. And that has been key to keeping you, your families and people right across our state safe. And that's coming through the numbers that we're seeing. Whilst the case numbers are substantially increasing, compared to where we were with the Delta variant, our position remains incredibly strong. Our number one priority here in New South Wales is to keep our people safe, and that will continue to be our priority as we move through this next phase. I know and understand that many people across our state today are anxious, but just like the challenges of the last 2 years, we will get through this challenge as well and come out stronger the other side. And we'll do that because of the effort and the spirit of the people of our state. We've made enormous sacrifices over the last 2 years, enormous sacrifices over this year as well, with many people not being able to say goodbye to their loved ones. It has been an incredibly challenging year, but we stand here today in an incredibly strong position as we head into 2022 because of the efforts and the sacrifices and the great spirit of the people of New South Wales. I would like to make some comments in relation to the booster program. Obviously that continues, and please make it your New Year's resolution. Go out and get a booster shot. That will be key, just like our vaccination rates have been in keeping people safe and opening up society. As I've said, we have 40 centres right across our state, 40 centres in operation here in New South Wales to receive your booster shot. If it's been 4 months since your second dose vaccination, please go out and get that booster shot. You can also get it at your GP, at your pharmacist. This will be key to build on our success over the last 18 months. Building on that success of the high vaccination program, our next wave of success will be based on that strong booster campaign. We believe just in our own centres as we head into mid-January, and Minister Hazzard might provide some further information in relation to this, that we'll be administering around 300,000 booster shots per week. Particularly want to thank our health teams in those centres who have worked tirelessly through the vaccination program, who have achieved that 95% vaccination rate, now embarking on this next booster program. And I really want to thank them for the work that they have done throughout 2021 in relation to that program. That will be key as we move through. Some comments in relation to National Cabinet yesterday. I thought it was an incredibly constructive meeting. The fact that we have all states and territories working together in national agreement provides confidence and unity as we move through this next phase. We strongly endorse the changes that have been made, whether that is the reclassification of close contacts as being in the main household contacts or somebody who you have been in contact with for an extended period of time of over 4 hours. In addition, the movement from isolation from 10 to 14 days down to 7 for both close contacts and those who have COVID. This will ensure, as we move through this next phase, with a highly vaccinated population, that we will come out strong in 2022. I want to thank the Prime Minister for the agreement that he's reached with each of the leaders across the country. I think that unity of position, and obviously different states will move through at different times based on the cases they have, but I think having that perspective, having that clarity will ensure confidence in our system as we move through. We've also made a change here in New South Wales for with the national agreement for those travellers returning from overseas. As of today, there'll be no requirement for a PCR test, but rather a RAT test on day 1 and day 6. That will significantly ease pressure on our testing, our PCR testing across the state, where we're currently seeing around 5,000 people flying into Sydney each day. So that will further ease that pressure. But the other area that will substantially put downward pressure on those testing lines will be the changes that we made yesterday. So my message today for people across our state is that if you are not required to be tested with a PCR test, don't line up, because you'll be taking the place of somebody who is required by New South Wales Health to receive that PCR test. Now, I understand that that's a change, and that will take some time to adjust, because the efforts that everyone has made over the last 2 years and the direction that we've provided as a government in circumstances of a unvaccinated population has been to go out there and get tested. But today, as we move through this next phase, in line with the position of the National Cabinet, if you do not need a test, if you are not required to by New South Wales Health, please do not line up. It's incredibly important, and Dr. Chant will more than likely speak to this, it's incredibly important that those people who need a test get a test, and we have a turnaround time as quickly as possible. So I want to thank everyone again for the efforts that they have made in going out and getting tested over the last 2 years. But as we transition, as we move through, this is a new approach that will ensure we keep people safe, we keep society open, and we have a strong next year. I also want to make a quick comment in relation to O call-outs. Dominic, Commissioner Morgan will speak further to this, but we're seeing a high increase in calls to 000. Please only call 000 if it is an emergency. Currently, around 1 in 3 calls do not require transportation. That is putting incredible pressure on the system. I want to thank our great paramedics across the state for the efforts that they are making, particularly during this time. This is always a difficult time for our paramedics and for ambulance call-outs, but that's why I say today, if it is not an emergency, please don't call 000. So in ending, can I thank once again our frontline staff right across our state. It has been a big year in New South Wales. It has been a difficult and challenging year, but we sit here today in a very strong position because of the efforts and the spirit of the great people of New South Wales. Despite the difficulties and challenges, New South Wales will be a bright year. I want to thank our healthcare workers, our teachers, our police officers, our ambulance workers, people right across the state who have been on the front line serving our community. And I'm incredibly proud to be Premier of this state, to serve the 8 million people across New South Wales who have made an enormous effort. We're in this position today with an incredibly low death rate, with a very open society, because of the efforts that people have made over the last few months particularly in getting vaccinated. That's kept our people safe. It's ensured we can open up. And I want to wish everybody right across the state, to you and your family, have a very happy New Year. Now I'll pass to Bradley.
Thank you, Premier. Well, look, it's obviously New Year's Eve, and it's a beautiful day here in Sydney, but it's also 23 months and 6 days since we had our first 4 cases here in New South Wales of the virus, the COVID virus, coronavirus. And I want to actually just emphasise that there's been a lot of twists and turns and changes as we've moved through it, as you'd expect, because the virus has mutated a number of times in that 23 months and 6 days. And as you would expect, the messaging therefore has changed as we've moved through it. But what we do know is that by listening to the public health team, Dr. Chant and her amazing epidemiologists here in New South Wales, we have achieved what many, many nations have not achieved. In fact, we are the envy of the world. Today we will have people out enjoying themselves, for what is going to be a brilliant Sydney and New South Wales day. Absolutely brilliant. But we also need to remember the basic messages that Dr. Chant and her health team have conveyed all the way through with this virus. And that is just enjoy the day, but also be cautious. That 1.5 metre social distancing still works. Wearing the masks when you can't maintain that 1.5 metre social distancing, and particularly if you're indoors and you're not eating or drinking, it still helps and it still works for us. So I just want to emphasise that. I also want to say this, that today we have 69 people in our intensive care units in our hospitals across the state. 39 of those are not vaccinated. As Health Minister, on behalf of our entire public health team, whether it's the nurses, the doctors, the paramedics, or all of our emergency staff, please just think about them and go and get vaccinated. We do know that the vaccinations make it far less likely that you will suffer any major consequences once you actually do get the virus. And as I've said, we are all probably going to get this virus at some point in the next year or two. This virus is going to be around for a long while. So please don't stand on your dig. If you've told your mates that I'm not going to have it because of whatever, well, now's the time to actually say, actually, you know what, I'm thinking about it. It's a new year, I'm going to change my ways and get a vaccination. Can I also say this, that the staff, the frontline staff, are all working under great pressure. Our health system is by far the best in the world, in my view, and I think anybody who's been in our hospitals would know that. But we've got more than 2,000 staff currently out of action because they're either positive cases of Omicron or Delta, or their close contacts. And whilst we're looking at what sort of changes might be possible on that front as we move forward in the balance of risk, at the moment we do know that our hospital system is working with frontline staff under a lot of pressure. So I would just ask every resident in New South Wales to realise that if you can just follow the rules but also get your vaccinations, you are relieving some of that pressure on our frontline staff. Be fair to our staff, be fair to our frontline health staff and our other staff, the police and so on. Please go and get vaccinated. The issue for us now, as we see the hospital system and ambulances working under massive pressure, is that each one of us can be empowered to change our ways. When you call an ambulance, it's because it's an emergency, and not because it's not an emergency. And the Commissioner will talk about some of the cases that he's had just recently of people still not listening to the message and still effectively abusing the use of our ambulance system and abusing our paramedics. They're there for emergencies. And if you do make a call which is a bit silly, then what will happen is that somebody else who might need it for example, a cardiac arrest, might miss out. New Year's Eve is always a tough time for the ambos, but with COVID also doing its best to get in our way, then it's going to be even worse this New Year's Eve. So please think about that tonight, today and in the next few days. Finally, I just want to say this, that youngsters, the 5 to 11-year-olds, can get vaccinated as from the 10th of January. The various vaccination services that New South Wales offers, and there are a lot of them, are open for bookings for our kids. And what we know is that it will keep our kids safer. That's the international evidence. As parents, please get your children booked in for vaccination. And I would also say this, if you happen to be someone who is in effect an anti-vaxxer, that might be what you want to do to yourself and risk death. Please don't do that to your children. Please book them in for a vaccination. Now I will hand over to Dr. Chant, who will bring us up on a bit more of the information and detail off the back of that National Cabinet meeting. And then after that we'll have the Commissioner for Ambulance and then Minister Ayres. Dr. Chant, wherever you are. In the shade.
Thank you. At other times I would be giving messages about sun safe and standing in the shade. So, just in terms, I just thought it might be useful for us to run through the changes. Some of them are bringing other states to alignment with what New South Wales was also doing. So, but others are changes. So in terms of the positive cases, it's now a 7-day isolation period, commencing on the day that you got the test positive. And unless otherwise advised, the person may leave the isolation after 7 days without formal notification or a further test. But if you are PCR tested, you will receive a subsequent text, and in that there is a clearance information which you can use for your workplace or other essential needs, because we want to minimise you having to go to another doctor or another healthcare provider at this time. It's important that you're well. You know, if you're still unwell at that time, that's the time then you should actually speak to your primary care or escalate any health concerns you have. And then if you're well and you're leaving isolation at 7 days, we want you to take some extra precautions, and that is about avoiding high-risk settings such as hospitals and aged care facilities for a further 3 days and wearing a mask. Now, in terms of close contacts, this is around the national alignment of recognising that households or people that have spent a significant time in households are the highest risk. And as a simple message that was agreed through National Cabinet, we're going to have 7 days isolation from the day of exposure and obtain a PCR test as soon as possible. Now, the reason I'm saying get a PCR test, it's really given our experience. Once someone in a household is positive, it's likely that everyone else has been infected and people rapidly develop it. So rather than complicate things, if everyone's tested, understands their status, they can then make decisions about isolating as a family unit, and then the isolation period becomes the 7 days. Also, they should be anyone who is a close contact in that very high risk group of a household or household like with the 4 hours exposure in a residence. They should avoid hospitals and aged care for a further 7 days, and then a rapid antigen test is required at day 6. And obviously, at any time, if you have a RAT, we recommend RAT positive, a rapid antigen test positive, we're recommending you get confirmation with a PCR test. All other contacts generally have a message of monitor for symptoms, and if symptoms develop, undertake a PCR test. But we recognise that other contacts group is such a broad group, and we are developing some tools and some guidance to allow people to really better understand their risks that they may have had in those social settings, so they can inform and take the actions that they need to take. So that's probably a summary, but I know that there will be lots of questions, and I think that in relation to the international travellers, we're moving to RAT test on day 1 and day 6, but if they're symptomatic, at any time you need a test. So at the moment, the key message is anyone with symptoms, get a test. We do want you linked in with care. So I know some people will be choosing to do a RAT test, and that will be probably a group of the community. But anyone with complex medical conditions, anyone with underlying health conditions, or if you're living with people with those conditions, it's best that you get diagnosed so we can link you into care, link your household into care, get those testing messages out there. But obviously we recognise some people are probably taking a RAT test themselves and making that own decision. But again, if your condition deteriorates with a RAT, you should treat a RAT as if it's positive. Like a positive RAT should trigger all of that isolation. You should behave as if you have had a confirmed PCR if you're choosing not to. But our recommendation is that we would recommend that you get confirmation of a RAT of a positive RAT with a PCR test. Sorry for tongue tie there, but I'm happy to take any questions after Dominic.
Thank you, everybody. Well, we stand here on the cusp of a fantastic New Year's Eve that Sydney's coming in for. What a magnificent backdrop we have. It's traditionally New South Wales Ambulance's busiest day of the year. And whilst we might be celebrating and opening up again, and that's fantastic, there are a few messages of caution that I really just want to talk to the community about today. Can I first say, what a fantastic job our emergency medical call takers, our dispatchers, and of course our paramedics that turn up to your door every single day have been doing in the face of what one of my colleagues said was relentless demand. Over the past 4 weeks, New South Wales Ambulance has seen a 50% increase in our 000 calls. I remember back in August when I stood in front of a press conference and saying we've just had the busiest day equal to our busiest New Year's Eve ever, and that was 3,500 cases. Tonight, our modelling is telling us that we could have up to 4,800 000 calls. And as the Premier said, not all of these are medical emergencies, and I'd just like to talk to you a little bit about those now. Probably the biggest cohort of patients that we're seeing are COVID positive patients. No one is saying that these people are not sick, but there are more appropriate services to access than 000. For example, if you're the current health advice, if you're under 65, if you're double vaccinated, if you're not pregnant and you don't have underlying medical health issues, then in most circumstances you will be fine to manage COVID at home. But we're getting a lot of inquiries, and that is what is leading to us being called out. 1 in 3 people not being transported to hospital. This morning, I only reviewed a call for a person who was saying, I just want to know if I have COVID. Another person was, I just want to get a PCR result on my test. Another person said, I want to schedule an appointment. These tie up our emergency medical call takers all the time and divert us away from the cardiac arrests, the chokings, the drownings. These are the things that we must preserve 000 for. Another part of our calls are about these really trivial matters. Now, I would like to say again, if you are otherwise well and you have no other symptoms and you have vomiting alone, this is probably something your GP can help you with. If you have low-grade abdominal pain, your GP can help you with. The bleeding noses, the sprained ankles, the sunburns, the toothaches, these are all real calls that people are making to 000. And with the return in workload that we've seen over the last 4 weeks and the increase in demand, we really need the assistance of the community to help keep us available for those really life-threatening cases. Another issue that we're being told is a major concern to our call takers is around people calling back to see when an ambulance will arrive. Again, because you're concerned, if the patient's condition has not changed, we will be there. The key thing is we prioritise all of our medical calls to make sure that we get to the sickest people first. So if we're taking some time to get to you, it's because we're dealing with other medical emergencies that are more life-threatening than the one you've got currently at the moment. Importantly, the last thing I need to say is there still maintains a myth in the community that by calling an ambulance you will somehow get treated in an emergency department quicker than if you go through your own transport. This is not true. All hospitals triage their patients for the highest priority patients first. So even if you do see an ambulance patient go behind the magic curtain at an emergency department, they will still be seen in the same time as any member of the public who walked in and attended with exactly the same medical condition. We are in a precarious time. We are well resourced for responding to medical emergencies. Every resource we've asked this government for, we have been provided with. But having our normal demand return and inappropriate calls on top of it place serious stress on New South Wales Ambulance. Thank you.
First and foremost, I'd like to thank all of the people of New South Wales for getting us through 2021 in such a strong way. We stand here on the cusp of another New Year's Eve celebration where we shine so brightly on the world stage. Last year, we had no people out and about around Sydney. This year, we do have people out and about. We do have people at our vantage points. We have people celebrating right across our city. Given the year that we've had, that is a significant feat, and everyone across the state should be congratulated for their resilience and their fantastic efforts in the way that they've responded to COVID-19 over the last 12 months. In fact, tonight is so much a celebration of our community's resilience. If you are coming into the city, please plan your trip. Visit our website, sydneysnewyearseve.com. It allows you to understand what are the ticketing arrangements for many of the vantage points around the city. There are some locations where alcohol is not permitted, so be aware of that. There are many road closures. My strong advice to you would be to leave your car at home and take many of the forms of public transport that we have available. There is a public health order also in place that manages what people can do in indoor settings. So if you're coming into the city, please bring a mask with you. If you're in an indoor setting, you will need to have that mask on. We will also have density provisions in many of our indoor settings at 1 per 2 square metres. Many businesses are really looking forward to seeing you tonight. It's been a very tough and difficult year for them, and you're such an important customer to them tonight. But most of all, the key message is to stay safe. Tonight is absolutely a celebration. Yes, there'll be less people out and about around the city, but there'll be plenty of people celebrating at home in their own way. It's so critical that you do exercise your own personal responsibility. If you're out and about, exercise that 1 per 2 square metres if you're indoors, 1.5 metres apart if you're outdoors. Treat everyone with kindness and respect. It's such a beautiful night tonight in such a beautiful city. It's a great way to celebrate the end of 2021 and the beginning of a new year. I do want to say a big thank you to the teams across the New South Wales Government and the City of Sydney that have worked so closely together over the last few months to prepare what will be a COVID-safe New Year's Eve. It does feel a little bit different to the years gone by, but that's because we're putting safety first. That doesn't mean that we can't come out and celebrate. It just means we have to adjust our behaviours to make sure we can have a good time as well as a safe time.
Questions?
The Health Minister about 2 weeks, 2.5. No, the Health Minister about 2.5 weeks ago said that we would reach 25,000 cases by the end of January. We're virtually a month ahead of schedule. How worried are you about the fact that that trajectory has come so quickly?
I think it reflects the international experience with Omicron, where we're seeing a rapid doubling rate. I think that we have to follow the COVID safe practices. We are protected by having a high vaccination coverage. It distresses me every time when I review every day, even twice a day, the ICU admissions where people have not been vaccinated. I'm also just a big call out to pregnant women. I know we've really messaged so much about safety of medications and other things in pregnancy that I can understand that you want to do everything you can to protect your baby, but can I just say, please get vaccinated. That is the safest thing you can do. There's a variety of vaccines we recommend for pregnant women. The vaccines are safe and effective, but pregnancy is a risk factor for having severe outcomes for COVID and severe outcomes for as a consequence for your baby. So please get vaccinated. I've just been struck by some of the admissions related to that recently. So I suppose my message is we have got a lot of COVID around. The case numbers are very, very high. We need to all play a part in keeping each other safe. We need to make those decisions, and I think we've given pretty clear guidance. Nothing's changed about how COVID is transmitted. It's just that Omicron is so transmissible, and we don't have the benefit that we had with the previous variant, that we were in the sort of a period where we were getting some protection against transmission. We're not seeing that to the same extent. We're hoping the boosters may help. So again, everyone coming forward and not delaying, like have a sense of urgency in coming forward to the boosters. But I would like to see the case numbers, not that that's our focus is hospitalisations and consequences, but I think we also would be sensible in trying to slow the spread of the disease through the community so we can keep our health services functioning and our critical services functioning, and we all have a fundamental part to play in that. I did in my 11 o'clock video really put out a plea that I can understand that at this time of year everyone wants to connect, and but if you've got the most mildest of symptoms, please just stay home and watch the celebrations on TV or connect on social media. Just don't go out. And that's a real plea to everyone. That's the first thing we can do. And then those other protections, such as when you're in indoor spaces wearing a mask, be careful on public transport, but it's really those indoor environments that are at greater risk. And I'm really encouraging people to go out and have those picnics outside, the barbecues outside, but also be very careful around vulnerable people. You know, respect their choices about perhaps wearing a mask, but at times you wouldn't choose to wear a mask just to keep them safe. I think everyone will have their own risk thresholds, and we just need to be very respectful as we navigate, you know, quite a challenging time. But we are well protected.
Premier, just a question on rapid antigen tests. Yesterday, after the National Cabinet, the PM said that rapid tests would only be free in certain settings, like testing clinics. Could you just clarify what New South Wales' plan is for free tests, and will it be more generous than just
Well, obviously we put an order which we made public in relation to 50 million rapid antigen tests. We understand the decision of the National Cabinet tomorrow, but obviously states will play an important role going forward. We're working through that now. There was obviously a place, I would say, definitely for the states to be providing rapid antigen tests for returning travellers into Sydney. In addition to that, we want to make sure vulnerable people, vulnerable and disadvantaged communities have access to rapid antigen tests. Those who need them, we want to ensure they are provided for them. So we put the orders in like other states. We expect the main set of those orders to arrive in mid-January, and we're working through currently the distribution and the cohorts which we believe that those rapid antigen tests will be provided. The other point I would make is, off the back of the changes yesterday, clearly there'll be some challenges as we move through this short-term period due to a lack of access to rapid antigen tests. So we're very much aware of that. We're working through that challenge, but obviously, like other states, we will ensure that those tests are provided to those people who need them, and we're continually looking at whether we need to purchase more as we move through this phase.
Just on rapid antigen tests, will the state move towards having a system of reporting results of those tests to health authorities?
Well, that's probably Matt.
We don't have a specific system where they'll be uploaded to health authorities. I think it's clear in our advice, and as we work through living with COVID, we'll change that advice at times. But at the moment, we're saying if you have a positive test, get tested using a PCR test. And the reason for that is that links you into care. It allows us to do a triage, it allows us to direct you some information. Moving forward, we may well change those settings, but at the moment what we're really concerned about is that people who are potentially unvaccinated, there are therapies that can be given to people that are unvaccinated to reduce their risk if they've got high likelihood of being hospitalised. And in the future there will be different antivirals and different medications. So we're going to have to work with the community to keep changing our messaging as we have different tools to combat it. But in the end, what we're trying to do, the purpose behind everything we're trying to do, is identify those that will benefit from therapies, link them to care, and allow people to self-manage the milder end of the spectrum. And I imagine that increasingly everyone is probably touched by people with COVID. And so people will know that for some people it's been quite mild, but what we need to do is make sure we've really supported those people that are at higher likelihood of having severe complications and needing hospitalisations, and providing preventative interventions for those.
With the boosters, sorry, you mentioned before that boosters might help to curb the case spread. If you've had COVID, are you still allowed to get a booster, or do you have to wait? You know how the vaccination, you had to wait after you've got COVID?
So again, the booster recommendations will be, we'll have to get a target to a guidance, but the general sense was get vaccinated again when you're well enough, and most doctors would leave it a short period, like I think we moved it to about 6 weeks or something, say recover in 6 weeks. But I think it's a good question, given everyone's been, a lot of people have acquired COVID. But clearly, in the end, what we're doing is building up both natural immunity and vaccine protection. But I don't want anyone exposed unless you're fully vaccinated, and I prefer everyone to have been boosted before they had the opportunity of coming across the virus for their own good.
Dr. Chant, just on hospitalisation numbers, they were updated today after the initial release, and basically it shows that they've almost doubled in the past week. Is that kind of growth something you and the health system have been anticipating for?
Certainly we know that we're mapping closely the number of cases and how that's translating into both hospitalisations and ICU. One of the things that we're going to have to tease out, and we're doing a bit of work to do that, is how many people are admitted what's with COVID as opposed to because of COVID. So when you have a large number of people in the community that have COVID, some of them will have babies, some of them will go in for appendicitis, some of them will go in there for other health conditions. And so some of the data is skewed by those factors, and we're trying to understand the true contribution. But can I say that in itself adds complexity for the health system, because once anyone is in there, even with a different diagnosis, it means the staff are wearing higher grade protection, we have to have more infection control. So even that we have to account for in our understanding of the impact those cases have. But it's a little bit more refined moving forward, but we are closely watching that.
Dr. Chant, can you clarify who needs to get a test on day 6, a RAT test on day 6?
So international return travellers, for them it's day 1 and day 6 with a RAT test. However, if you have symptoms at any time, get a PCR test. In terms of the day 6, it's for household, that category of the household contacts, or the people that have been there for 4 hours. So it's sort of household-like contacts. And then that's probably the main group that needs the day 6 RAT test. And then, as I said, the other advice is that we're recommending that PCR testing for household. That's really just because we know from our experience that most households, when one person in the household's positive, the tests come back positive on the rest of the household, and it just does allow them to take those practical steps about how they're isolating.
Is there any concern that people may skip that test, especially if they've got plans coming up the next day?
Look, I think what we're moving to with it is really the fact that I've been so pleased that the vast majority of the community do the right thing and actually do not want to pose a risk to anyone. So this is going to be, we certainly are going to have to enhance our communications. It'll have to change. We have to, continue to engage with the community as we take them on what living with COVID looks like. But I'm, so amazed with the community in terms of its behaviour.
Dr. Chant, just on the 25,000 modelling prediction that was given about 2 weeks ago, the end of January, we're clearly going to move past that. Can you update us on what you're really expecting now? Is there any updated modelling of what we might be at, in a month's time?
So clearly, look, that modelling data was just based on the trajectory, which is like a doubling rate, and I think many people out there in the community can do what that looks like. The unknowns we have is what behaviours people have actually modified. We know Christmas is generally a closed down business for workplaces. We know that travel and activities are usually decreased. So that's one thing that would probably decrease transmission risk. But then the other thing is we know that you start to mingle with perhaps social networks that you don't normally mingle with. So you bring generations, you bring people you never, so that's sort of a seeding event to other households. So to some extent we're watching closely. The transmission initially happened very much in the younger age groups, and I feel bad calling 20 to 39 people age group young, but in epidemiological terms they're the younger ones. You are young. But I think what we're concerned about is also once you start to shift into the older age groups, do you see a higher rate of hospitalisation? So you've got to look at all the data. One number cannot tell the full picture. We've got to actually tease out lots of elements in it. But that's why we really want the boosting message, particularly if you've been elderly, elderly chronic conditions, you should be lined up. And also, can I just ask that if GPs are making decisions, they may well be making decisions to prioritise people that perhaps have had, over 60s who may have had AstraZeneca, who are needing that boosting or have had a shorter interval. Doctors may well be making some of these decisions as they're trying to balance their needs. Please be understanding, because we do want boosters in the arms of people that have the highest risk of becoming hospitalised.
Premier, just one final one, Premier. Usually on New Year's, the harbour would be absolutely packed. Even up here at Mrs Macquarie's chair, there's only a very small number of people.
Yeah.
Do you fear that this is Sydney telling you that they don't have confidence in the way we're approaching this?
This is a much greater event than it was last year, and this is, as we move through, people are taking personal responsibility for making their decisions to ensure they keep themselves and their family safe. We've always said that vaccination is our key to opening up society and learning to live alongside the virus. Today, I think this last period of time, is the real moment for our state. Our state is standing strong. The spirit and the efforts of everyone, which people have made over the last 2 years, has been extraordinary. To be in a position in New South Wales with such a low death rate, to have a strong economy as we open up, we are leading the nation out of the pandemic. And obviously, with significant case numbers, people will be anxious across our state. But we will stand strong, just like we have over the last 2 years, and get through this challenging time as well. We've done it before, we'll do it again. The key has been vaccination. The next stage is boosters. As I said, make it your New Year's resolution. Go out and get a booster shot. It will keep yourself and your family safe. And New South Wales will continue to lead the way.
Healthcare
workers and lab technicians alike say the system is at breaking point. The St Vincent's Hospital's Executive Director sent an email to staff saying that the number of cases and hospitalisations has left them extremely vulnerable, and also one of the largest pathology services in the state is saying their work has become impossible. Have you accepted the fact that New South Wales is now in a state that is not acceptable now, and those are no longer short-term challenges?
There's obviously challenges in any health system, not just around the country, but around the world. But as the Health Minister said, we have the best health system in the country. And that is because of years of investment. We have the best healthcare workers on the job providing that care each and every day. As we've always said, the key focus for us, and as Dr. Chant has pointed out, we monitor every single day our hospitalisations and our ICU capacity. We go back to the Delta outbreak. We had over 240 people in ICU in New South Wales. Today, that is well below that figure. And that is positive, but we monitor it. And as case numbers increase, we continue to monitor that situation. Our number one priority as a state is to keep our people safe. The key to doing that has been vaccination and now boosters. There are a number of rules in place, and as people go out over the summer period, we ask you to continue to follow those rules. The social distancing, wearing masks inside. These are the things that will help us move to the next phase. We monitor the situation. A particular key focus for us is ICUs and hospitalisation presentations, also the health workforce as well. As case numbers increase, we believe the changes we made yesterday at National Cabinet will put downward pressure in that space, but we are working on this each and every day to keep our people safe. Our health system remains strong. As the Minister said, it's arguably, certainly the best in the country, arguably the best in the world. And I'm very proud of our health workers, our frontline workers, for everything they do. There is no doubt there'll be bumps along the way as we go through 2022. We are in a pandemic still, and there'll be different curveballs come our way. There'll be challenges out of the changes we made yesterday, particularly in relation to rapid antigen tests, continual pressure in relation to PCR tests as case numbers increase. But we will look at those challenges, we will meet those challenges, and we will come out stronger out the other side. And I just say my final message is I think our strength as a state has been the values that everyone across New South Wales has displayed over the last 2 years. We continue to treat people with kindness and respect as we move through this challenging period. We are in for a very strong 2022. Thanks very much. Oh, and can I finish by thanking the Auslan interpreters for not just for today, but everything that they have done over the course of the last year. Thank you. Thanks, everyone.
Thank you very much. Thank you, guys. Thanks, everybody. Happy New Year, by the way, everybody.
Happy New Year.